Well, having surgery, how do you pick the best hospital and the best doctor? They're important decisions, yet we don't always know how to make them. Now a new guide could help. Here to explain how it works, Dr. Arkel Giorgio. Good morning, doctor. How are you?
Good, thank you. How are you?
I'm doing fantastic. So what are some of the most common problems we face when picking a hospital or even picking a doctor?
Some of the most common problems are that we rely too much on referrals from family, friends, even our doctor, and we don't take the time to do our own research. And here's why that might translate into a less than ideal outcome. In Omaha, for example, 17% of patients get care at the hospitals with the highest complication rates and the highest mortality rates. I don't want to be part of that 17%, nor do you, but if you do your research, you can avoid that.
Yeah, you bring up a good point because you always ask somebody, hey, do you know a good doctor? I mean, really, what do your friends know about this? But what type of questions do patients need to ask when selecting a hospital or a doctor, especially for a major surgery?
Well, it's really a two-step process. And so the first is doing your research to identify the doctor that has the greatest experience doing the surgery or treating the condition that you have. So it makes a difference if you're going to have shoulder surgery or knee surgery when you're seeing an orthopedic surgeon. The more experience they have usually leads to better outcomes and lower complication rates. So identify the doctor with the greatest experience. You can get that information on healthgrades.com using the experience rating. And then you're going to find a few doctors that meet that criteria. So then you want to select the doctor that admits their patients, does their surgery at the hospitals that have the lowest complication rates and lowest mortality rate. So let's take an orthopedic surgery example.
Okay.
If you wanted to have hip replacement surgery in Omaha, I'll tell you that 24% of the people in Omaha, that's 1 in 4 just about, have their surgery at hospitals with the highest complication rates. Instead of doing their research, they could go to CHI Health Emanuel, Nebraska Orthopedic Hospital, and have a much better outcome.
Yeah, can you describe how the guide works? Yeah, you've mentioned it a few times, but how when it gets to the nuts and bolts, how does it work?
Well, the nuts and bolts of the guide is you go to healthgrades.com and you can search by over 12,000 different conditions and procedures. But sometimes people don't want to go through all of that effort when they're facing a medical condition. So what the guide does is it puts at your fingertips in every market, in Omaha, for example, just cuts to the chase, the top hospitals, top performing hospitals by different conditions. So if you're having joint replacement surgery, heart surgery, valve surgery, gastrointestinal surgery, it can quickly just list for you the top hospitals in your area for your condition.
Doctor, what's been the response from patients who've used this site?
Patients that do their research feel much better about the decisions that they make. You know, healthcare decisions are a very important, they're a heavy emotional process. And so it's really important to get the best information, because if you have an outcome later, you don't ever want to look back and regret whether or not you did the right research and you did your part in getting to the right care. So people that do their research think it's the best step that they could have taken.
Yeah, good information, doctor. Again, tell us how to get to the guide again.
Go to healthgrades.com.
Easy. Doctor, thanks for your time this morning.